there, I'm Lisa, I'm from the lab, I'm here to take your blood today. I'll have my lab order. Can you please state your name and your birth date?
Jana Bowman, 7/16/67.
So I'm matching my lab order to my bracelet. And then this is when you can start, as you're getting ready and thinking about what you're doing, ask your questions, Have you ever had your blood drawn before?
Yes.
Have you ever had any complications with having your
No.
blood drawn before? Are you allergic to alcohol, latex, or adhesives?
No.
Are you on any kind of blood thinner such as aspirin?
I did take aspirin.
You
today.
took an aspirin.
Uh-huh.
So what does that tell me?
Honestly, I did.
So what does that tell me? That means we want to put more pressure on the spot afterwards. We're probably going to take a little bit longer to hold pressure than visualize. And it might change if we put a Band-Aid or Co-Band on. Okay? Do you have an arm preference?
This one's fine.
Okay. So which setup would you like to see? Do you want this one?
We're gonna have to see.
Okay.
Yeah.
Well, I have different options. So you open up your package, and then this little piece of plastic is only holding all the tubing together. So you just take that off. That's just a clear thing to hold all that. I like to stretch my tubing a little bit to get all the little kinks out of it. It also is making me feel for any imperfections in the tubing. What if all of a sudden I felt a real flat spot? In the packaging, these are heat sealed in there, so they could have accidentally, in somewhere in the tubing, heat sealed, and there's not an opening in there, so blood wouldn't go through no matter what. So that also gives you a way to double check your tubing to make sure everything is good. Now this one just has a clean cap on the end, so I'm going to take that off. And if you see, it's similar to that top, but we can't use it for anything, so that's trash. So I'm either going to put one of these or a syringe, and I'm going to put this in. All I do is just stick it in the end there and twist it on. Okay. When you're feeling your butterfly, you're going to feel in the back of the wings is going to feel like little grippies. That's the part that you want to be holding up into your fingers. Because now this hold is a little bit different. You're not doing your C like you did. You're going to see people that want to stick like this, but that's the safety feature. You don't want to hold that. What you want to hold is the wings. Okay, the wings are what we're doing. And why a lot of the nurses like this is because this is the way that they hold as they're doing IVs. So it's a more normal feeling for them. That's why they like it. Okay. Hurry up, guys. I'm going to just show them these packages, other packages real quick. We had
Smile.
this one here, we had to attach this hub to. This one here, if you see, comes as a complete unit. This one has where you would have to attach it to a plain hub. The other thing is, see where it's from white to clear, this piece can come out where a syringe can go on the end, because you can also do a syringe with a butterfly. Okay. Same with this one. If I took this off, I can put a syringe on there. But then you still need a transfer device to transfer your blood afterwards. Okay. So after I decide, as we see, Janet has a lot of different veins to choose from. But we're still going to put a tourniquet on. It's still 1 to 3 inches above your intended draw site. So we're just going to put our tourniquet on here. So now when we're looking at deciding her veins, we're looking for ones that stay the most stable. And the way you can do that is kind of rub your finger on them. So she has choices. Now where I don't want to stick is, let's say, right here or right there. And that's because, if you can tell, there's a valve there. There's a valve there. That's going to be very painful, and it's going to be very difficult to get any blood. It's going to be harder to stabilize the further you get down. So we can either pick this one or this one. And I'm going to pick this one, and I'm going to pick it above the branch because there's a valve there. Okay? So we'll remove our tourniquet as we're getting our things ready.
I'll try to post that on that discussion board for everyone.
Okay, and we get our alcohol out. We're going to clean our intended spot. let it air dry. Get your other things. That's for Todd.
Good idea.
You make it look so easy.
Now, depending on where you're working at, you can, if you have a table, you can leave this sitting here when you go to stick and then reach over and push on your tube. But let's say you're in a patient room where you have to dangle everything in like their hands. So what I'm going to do is I'm actually going to bring your whole hand forward. And then we're going to put your tourniquet back on. Relax your hand, Janet.
Okay.
You don't want your person tensed up. Same thing as you can do one-handed or two-handed to take off the cap and let it fall. If you're going to have to hold it, if you just rest this and kind of keep a pinky on it so that you have a hold of it, because if I stick and I don't have a hold of this and I let it drop, the needle could come out. Don't want to do that after you just stuck a hard vein, right? So hold on to it. Then what you want to do is anchor the vein from either, if I'm down here, or I'm going to kind of hold her thumb out of the way from here. The reason I want to hold on to the hand is if I just anchor like this, Janet, pull away. Pull away, like if you're pulling your whole arm back. Look, she's going to go away. Okay, now if I'm anchoring here, Janet, pull away. I have control over her. She can't go anyplace. So I'm going to anchor my vein. I'm going to go in, up, push,
Wow, look at that.
go, tube on, let it fill. Let it fill to capacity.
Did you do it in slow motion?
I know.
That's how fast I stick all the time.
Holy crap.
She'll tell you, did you feel it?
Oh,
That's why.
that was awesome.
And you can, since you have 30 seconds, you can start your next tube. Get this one mixed. Okay. Waiting for that one to fill to capacity. I have enough in there that I know the vein's not going to collapse, so I'm going to remove my tourniquet. Then I'm going to mix. Now this is where it gets tricky. These newer butterflies are made now to activate from the vein. So I'm going to rest my gauze. So I can either hold this way, and you're going to squeeze this piece, and then just rest, pull the tubing, or press. If you have trouble holding that way, then what you do is you rest this way and hold this way if you want to be able to see your tubing. And that's the way I like it. So I'm going to hold here, squeeze, pull, press. Did you hear it click?
Yeah, I heard it.
It's also audible. This whole piece goes into the sharps.
Oh.
I need to save the fit. And then I'm going to hold pressure, and because this is a hand, it's going to bleed more, especially since the vein is so much closer to the surface. So that's why I'm not going to look right away. I'm going to hold pressure. Hands tend to like to bubble up more. Okay. Then I'm going to do my 2-point check of bleeding. And if you can see, you can barely see where I stuck her. So I'm looking for 10 seconds. I don't see bleeding out of the skin or under. I'm going to then fold over my gauze to keep the added pressure. I'm going to get my Band-Aid. And I'm going to put that on, and as I'm putting it on, Jenna, if you can please leave this on for about 10 to 15 minutes. If it does bleed when you remove this, please hold direct pressure on the spot until it stops. And if you can please wait here while I label your specimens, and then I would label my specimens with my patient's right name, date of birth, the time